Great. Thank you. So, good evening and welcome everyone. Great to have you with us here. Those of you who've not met me before, I'm Faisal Hussain. I'm the interim group chair for Northamptonshire Healthcare Foundation Trust, but also Leicestershire Partnership NHS Trust. We're carrying out our members webinar today where we'll be covering strategy and a couple of other items. So hopefully it's going to be a really informative session. As I said, we're recording this session, so if you don't want to appear on screen, please feel free to keep your camera off. We completely understand. But if you're happy to be seen, please. It's wonderful to see all the people who've joined us. It's always good to see who's with us from our members, staff and governors who've joined us for this session. And as I say, unfortunately, we've got an apology from Alison Gilmer, who's our Director of Strategy and Partnership, but very ably represented by Glenn Edwards, who's here. So if everybody's happy, I'll hand over to Glenn to start with our Thrive strategy and how that came about and what that covers. And there's some questions that have also been received. I'm hoping that between Glenn and David Williams, who's our Group Director of Strategy and Partnerships. So David very kindly straddles both NHFT and LPT in his role. They'll hopefully capture those questions. But if there are other questions, please put them in the chat box, or at an appropriate moment, we'll bring you in. So over to you, Glenn.
Thank you, Chair. Thank you, everyone. It's great to be here. As we've mentioned, I'm Glenn Edwards. I'm Group Head of Strategy and Partnerships, and I have a group role. So I work across both Leicestershire Partnership Trust and also NHFT. Tracy, will the slides be shared, or do you want me to share them?
Yeah, they should be on screen any second, hopefully.
Yeah, that's great. Thank you. So as you're aware, I'm sure, both Northamptonshire Healthcare Foundation Trust and LPT, Leicestershire Partnership Trust, have been working closely together for about 7 years now. We formalised a group arrangement back in 21, and this year we launched our first group strategy, Together We Thrive. In order to get to that stage, we spent about a year or so speaking to about 3,000 people. They told us what was important to them, what we needed to focus on, and what we needed to prioritise over the next 5 years. So it's a really important document for us, and something which both organisations are using in their day-to-day work, really. So some 10 months have passed since we'd actually launched Together We Thrive, and we feel that we've made some real progress, and it's great to be able to share some of those stories here today for you. Can we have the next slide, please, Tracy? So we are two separate trusts, but we do work towards the same mission, the same vision, and a core set of strategic objectives. And all this is wrapped up within Thrive. So Thrive is our acronym, which stands for Technology, Healthy Communities, Being Responsive, Including Everyone, Valuing Our People, and then being efficient and effective. So this is what our consultation came up as the most important things that we needed to focus on over the next 5 years. We do have two separate transformation teams, but we are working towards the same group strategy. So we're working together closely to align and prioritise all the activity over the next 5 years to meet the ambition of Thrive. The differences in the number of programmes that you can see on the screen is probably really semantics. Different teams can define a project or programme differently, but also how they cross-cut different elements is also quite different. But hopefully it just kind of gives you an assurance that transformation is system-wide across both of our organisations, and that every activity is being aligned where possible to Thrive. Next slide, please, Tracy. So these next slides really highlight some of the activity which we have achieved already since Thrive was launched. Within each letter of Thrive, we have 3 strategic objectives, as you can see on the right-hand side. I'm not going to read through these line by line, but I will highlight some so you can see some of the activity we're doing and how it aligns to some of our objectives. So this is technology. We have successfully deployed secure networks to our new prison sites. This is helping us to ensure that our secured services have the technology that helps to improve patient, service user, carer access, experience and outcomes. We've currently appointed 2 joint deputy directors across the group, which shows our commitment to digital leadership for both organisations, but also as a group focus. And then importantly, we've also launched our new and first group-wide digital plan, which is really about making sure that we can maximise the opportunities and advantages of technology for us as a group. This is both for our staff, volunteers, but also for our patients and service users. Next slide, please, Tracy. The second one of our core themes is healthy communities. So some examples here. We've led on a school nurse-led asthma project, which is really about understanding our data and local intelligence to target poor outcomes within schools. So this is about helping people to stay out of hospital and being supported at home or in their community. We have a real strong group commitment to understanding did not attend and was not bought, so appointments that don't actually happen, understanding that some of these can make health inequalities worse. So we're developing apps, we're sharing data with our staff, making data accessible to increase professional curiosity so people can understand and have a conversation about health inequalities and perhaps call things out that they think perhaps may not be fair. And then we've also published a social value plan, which is really important to us. It's about how we invest in our communities, taking our role as an anchor, community anchor really importantly. So we're obviously a large employer for the local area, but we also invest in our local businesses too. So how we can maximise that arrangement to the betterment of our communities is really important to us. So that plan's really important over the next 5 years. Next slide, please, Tracy. So the next one is about how we're being responsive, so responsive to need and demand locally. We've increased stroke bed capacity to meet the demand and need that we have within our local communities. Motor neurone disease coordinator has been employed. This is to make sure that there's timely access into services. So this shows how we're adapting to the needs of our community. And then taking that a step further, having an arrangement with a third sector to have coordination roles to enable that transition between services, but also to make sure that people are in the right support where possible. So working with our third sector, absolutely critical for us to achieve our ambitions within Thrive. Next slide, please, Tracy. Involving everyone. So at the heart of everything we do, we want to be an inclusive employer. This is just part of our culture, but it's really important that we have programs and projects which really define this for us. So we have a Together Against Racism program, which has been fairly long established actually, but it's really starting to develop clear group standards and expectations as us as an employer, but also us as an anchor organisation. So this really ensures that we have a culture which really embraces inclusivity and really making sure that everyone matters, whether that's staff, volunteers, patients, service users, carers, families, or just communities in general. We have really progressed our University Hospital Association application, which is really exciting for the group. It'd be amazing to get the status where we're increasing research locally, but we're also being seen as a centre of excellence. Really great for our staff and our community, but again for our patients and service users. And then kind of wrapping all this up together with being really co-production focused. So we now have a group co-production charter which sets out the standards and expectations of how we work with patients, service users, staff, but also our communities, and how we can channel that to improve care, quality and access. Next slide, please, Tracy. Next slide, is that
Oh, is it not
everyone
moved?
else? Not mine yet, so.
Has it moved?
It hasn't for me. I don't know if it has for anyone else.
No, it's not moved yet, Tracy.
Try that again. Has that worked?
Yet, no.
No.
If you want, Tracy, pull your screen down. I'll with mine up.
I can't
then-
see it. I think it's got stuck. That's the problem. So
That's
I'm going
fine.
to leave the meeting for 2 seconds, and if someone
Yeah.
wants
Oh, there
to...
you go.
Oh,
It's there
Oh,
now.
is it gone?
now.
Oh,
Yeah.
there we go.
So we've got valuing our people there now.
Yeah,
There we go.
that's great. So that's given me a few seconds just to catch my breath. So that's helpful anyway. So yeah, valuing people, again, clearly important for any organisation, but we were told that, you know, via our consultation that this had to be a priority. We were told this by our staff, but also our patients. So we've held a staff conference, which I actually spoke at one of them. So 260 people attended. We had a focus on psychological safety and health inequalities. So this is really an example by which we're trying to ensure that everyone is seen as a leader across the group, and that we're empowering them to look after themselves, but also look after their staff, but also ensure that we deliver services which are inclusive. We had a really good national staff survey result, which gave real strong and positive feedback, identifying the difference we're making for people that work for us, so making it a safe and happy place to work. And then finally, we've set up some workshops and cafes so we can start to share learning across the group. One of the benefits of working in a group arrangement is that we can learn so much from each other. We might have different populations and demographics, but the opportunity to have that shared learning is super important. Next slide, please, Tracy.
Is that the correct
Yeah.
slide?
It is, yeah.
Yeah.
So this is our final part of Thrive, being efficient and effective. I'm sure you can appreciate this is a really important element of our strategy. So we do have a value program in place, which is identifying, targeting efficiency opportunity, whether this is workforce costs through to pathway improvements, but really making sure that any decision we make or have to make considers value for money for the taxpayer. We have developed a quality improvement toolkit, so making sure that continuous improvement is at the heart of everything we do, and then how we implement that across the group is a great opportunity. But then also prioritising the retention of the National Institute of Health and Care Research regional delivery network status. Bit of a mouthful, I apologise, but that's really about making sure that we contribute to research, leadership and innovation as a group, which is really important for our university hospital status. So as you can see, a lot's happened in the last 10 months. If I can just go on to the final slide, Tracy. This provides a roadmap for the next 12 months. So we do have a clear plan in terms of what we need to prioritise over the coming 12 months. Again, I won't go into every detail of this, and I'm sure that the slides will be shared, but I will just pick out a couple from each area just to give you a flavour. So there'll be a strong focus on understanding AI and the role in terms of how we work, and so how it can make us more effective and efficient, but how we can deliver care closer to home. Using health inequality data to inform and set priorities, but also developing action plans across the group and sharing that learning So really understanding, some of the pressures that communities might have in terms of accessing or just generally experience and outcomes of care, and really identifying that unwarranted variation. We're going to be focusing on community nursing and inpatient vision and goals. So really making sure that patients receive the best of care, the highest standards, and that we're patient-centred. The submission of our university hospital application. We're going to do a survey on Thrive to really understand how we're implementing and mobilising Thrive, but actually how we can do better and do more. So again, this kind of sharing of learning being really important. And then finally, the continuous improvement workshop and agreeing core principles. So how we work in a group setting for the betterment of our patients and service users. So hopefully that's given you a good flavour and a good update in terms of what we've achieved, what Thrive really means to us as two organisations working in a group space, but also our plans for the next 12 months. Really happy to take questions. I hope that's been helpful. Yeah, thank you.
Thank you, Glenn. That was very helpful to hear and see the progress against the Thrive strategy that's been developed in combination with NHFT and LPT. Any questions from colleagues? Were there any in advance, Tracy, relating to the Thrive strategy? David?
I was going to say, if people to give people a chance to think, I'm quite happy to pick up some of those ones that we've had through in advance. So shall I do that now? And then if others want anything to add or that sparks some other questions, more than happy. And one of the questions we'd had in advance just talked to us about and asked us what were our ambitions around the NHS 10-year plan, the technology element of Thrive, how will we work with anchor partners and innovate and take technology forward, and things around social value. So there's quite a lot to unpick in that question. So I'll try and do it justice, and happy to come back to anything where we're working. So Glenn's just talked a little bit around the technology element of using AI and ways of working. So we are doing some work at the moment around ambient voice technology. It's the technology that is being used in the NHS that can hear and listen to a consultation, a conversation going on, and then turn that into a clinical record. And that can be a very, very helpful summary for clinicians. And in the trial, clinicians are just exploring that sometimes it picks up on things that they would have missed. And so we're working through how that can be used and work through. So that would be one example. And the advantage that does, and the clinicians that are trialing it at the moment, is just reflecting through that it really helps them listen to the patient or the service user, because you're not typing notes, listening, writing something up and trying to do all these multitask bits. Actually, you can really concentrate. So there's opportunities and things like that. And the other challenge, one of the other challenges we've set ourselves to do, is to really have a think about what are the activities that we are using a person for, which are simple automation. And we've done quite a few things, like how do we process invoices? How do we move things forward? If they're all completed in a correct way, actually, can a robotic process automate it and move it through to the final stages for approval and so on? And that means that we can use people in a better way and working things through. So things like that. I'll touch on one of the other bits and just also sort of say the social value element, the anchor institution in the bit, is important to us. And we've spent some time looking at things. So a couple of statistics and things to help you understand. And by sharing them, I hope what it does is it shows you that we're looking at things and thinking about how do we make a difference? What else could we do? But our data shows us that 84% of people that we employ in NHFT are local people, that we've got 22.1% of our workforce part of the global majority, 19% of our suppliers are local, and we work with over 250 volunteers. Now, all of those things kind of reflect on things that we keep doing and planning on and talking about and thinking, this is, together we want to make a difference. Together we're making a difference. It's those sorts of things as an example for that. a way of working those things through. So I guess that picks up one of the questions around Thrive and the webinar and ways of working stuff through. For today, I think we're probably going to mainly pick up Thrive and the strategy questions and the ways of working through. I can see, Irene, you've popped some stuff in chat. I'll need a moment to read through and see that. It might be some of the stuff, or Richard will come back and we pick some of it up offline. I'll pause for a moment, Faisal, but there's a couple of other questions linked to the strategy that I could also cover if that's helpful.
Sure. Thanks, David. I mean, that is helpful. I think it's also worth mentioning that when we're talking about digital, David, one of the things that I know we as boards have been very clear about is that people, when they hear that we're looking at how best to use digital innovation to improve healthcare, we're also very mindful of the fact that not everybody will be able to access certain types of digital software, etc. So we are making sure that nobody gets left behind in that process. And quite often, these terms that are banded around like digital poverty and digital literacy. So just for any of our members listening in today, that is very front and center in our minds. So we are making sure that we capture that. I'm not seeing any other question at the moment, David. I think Irene's questions are very specific to SLAs, etc. So thank you, Irene, for putting that in the chat box. We'll make sure that's taken away offline, and then we'll make sure that the most appropriate person gets in touch to kind of follow up that. And thank you for also mentioning the transparency point. That's very much appreciated. David, do you want to carry on with a couple of other questions you've got on the strategy?
Yeah, can do. And just so one of them was a question around mental health services and crisis. So if I provide a little bit of an update, but the work we're doing, so community and mental health teams and connecting those to our neighbourhoods more and developing and bringing that forward is a key focus. And when we go on to the presentation that I'll give after this one, I'll talk about the direction we're going around population health and how do you support people and organisations and ways forward. So really building mental health services that have got greater connections with community organisations and local communities becomes a real focus. That's not to say we don't do this already. There's a whole range of different things. I was chatting to somebody just before this meeting about some of the work we really got going over COVID around providing cafes, drop-in points and things for people to come and get help. So there's a lot going on, but definitely one thing for us to really look at and how do we build on it and work through. And then one of the other government focuses and things we're really, really pleased to look at and think differently about is we do have a lot of services for people who are in crisis in mental health, but an opportunity to think that the government's having a bigger focus on that and how could we use that to improve services in Northamptonshire and finding ways of working. So lots of different bits in there on that one. And then the other bit that people just wanted to look at and just ask was also about how would our strategy align and collaborate with underserved communities, community health and wellbeing and charitable organisations. I'll probably partly answer that now and partly answer it later, but Together We Thrive, building compassionate care and wellbeing for all was a real deliberate decision about all of the words in our vision for our strategy. So firstly, it's worth thinking that together is both the frontline clinician working with a patient or a service user. The together is also many organisations working with each other to deliver care and to work things through. The together is also about supporting families and carers. And the all was a real deliberate decision to say that our job is to provide compassionate care and wellbeing for all. And that needs to be everybody, not just people who find our services. We need to think about people who don't necessarily immediately connect with our services and how do we do that and how do we do things differently. And to help reinforce that, of the 6 objectives in Thrive, we were absolutely committed to saying one of them's got to be healthy communities. People have got to, and the difference it makes in Northamptonshire about people having a safe environment to live in, having a purpose, living well and healthy, all of those things interact together and give people a far better, more productive life. And that we think we should be playing our part in that.
Yeah, no, absolutely. Thank you, Dave. Stuart, you were kind of expanding on a point about the role of AI and innovation and how to work with partners. Could you just briefly expand on that? What are you trying to get at? So make sure that we can answer your question appropriately.
Yes, certainly. Thank you very much for the answer. I think for an SME like ourselves, we're invested in the local community. You know, we work with the anchor partners, the local authorities, the university, schools, community and voluntary sector, and the NHS trusts. And we're trying to innovate in ways that are going to deliver benefit. One of those ways is we have a project around balance using computer vision AI to prevent falls and also provide support assessments of falls. So we did a recent event at Western Favourable Library with Digital Northants, where we were showcasing some of this technology. One of the key challenges around clinical research, which can be extremely expensive. So we can see an outcome, we can see a benefit to society in terms of reducing falls and preventing falls. But obviously, in order for an SME to fund the clinical research, in order to be able to access the NHS, that's very expensive. And NHFT have been fantastic in pointing me to various different grants, but I'm also I'm an innovator. I'm not a grant expert. So how can local businesses, innovators work with the anchor partners and community and voluntary sector to jointly co-develop and explore new technologies to deliver a benefit to the people of the area?
Yeah, thanks, Stuart. That's helpful. Thank you for expanding and clarifying. David, any immediate thoughts?
Yeah, not a problem. Thanks, Stuart, for that and that perspective. I think if it's okay with Richard, what I'd say is let's share the email address for the Foundation Trust email. And it would be worth, Stuart, you just sending in a little bit of info. Who you're talking to in NHFT at the moment and we're working things through. I think what we could then do is connect you with our research and innovation team and have a look at what's going on, where that's working, and then see where those opportunities come through. So that's probably the best way of getting into the detail and thinking how we are. And then, I mean, you're identifying some lovely important bits about preventing people with having falls. Is Mabel, I think I'm just going to pop you on mute, or Tracy if you beat me to it. Yeah, there we go. So preventing falls makes such a big difference, because if people don't fall over, actually they don't have to go to hospital. And the challenge with care in hospital is often that people who are frail and had a fall don't move that much, so then come out and need more care afterwards. So if we can do something like that, that would have a big benefit to society.
Yeah, thank you, David, and thank you, Richard, for popping the email address into the chat box. Stuart, the other thing that you're already probably aware of, but a number of not-for-profit organisations are also forming collaborative partnerships, because, as you rightly point out, that smaller organisations do struggle on their own to fund research, etc. So there are opportunities, and part of that, just looking out for those opportunities, is building through national networks, but starting regional networks is a great way. So with my other hat on, I'm a member of a national charity, the Spinal Injuries Association, and one of the things we've started doing is linking up with other organisations with similar interests, not always necessarily fully aligned in the same cohort of people that we see, but that those national interests are aligned. So we're working with the MND Association, the Parkinson Society, for example, and we're coming together to do similar kind of research, like neurogenic bladder, bowel, etc. So if you keep a lookout for regional and then national things like that, that might also be helpful. Okay. Anything else from anybody on Thrive? Because I think I think hopefully you got a good sense of the journey we've been on, and I hope that from Glyn's presentation you got a sense of what it is we're trying to achieve through that, and some of the progress that's been made. Duncan.
Yeah, Faisal, let me just introduce myself again. Duncan Orme, I'm one of the non-executive directors. And David, I think the presentation is really good, and clearly for us on the board, it does more than resonate. It reflects our discussions that we've been having with this strategy and the engagement there's been across the board with it. One of the things I thought I'd just pull out, Faisal, for our members community here, it is under that, including everyone, the work that members themselves have contributed to in the discussions we've had in this forum about our veterans community. And I think a number of us have taken the conversations that members have contributed to that away and found that inordinately useful. So I just wanted to highlight that as an element of the strategy that's in action and is showing here in these meetings. That was all. Thank you, Faisal.
Yeah, thank you, Duncan. And I remember from that last webinar on the veterans one, Duncan, that we actually put people through a presentation connected with other people who they weren't aware of in the local patch who were doing similar things, and they were able to outside of the meeting join up. So yeah, it's a real value of getting people together and doing things inclusively for everybody. I'm not seeing any other questions on our strategy, so with further ado then we'll move on, but we can always pick up if there's anything that prompts in someone's mind while we're all here together. We can always come back round to it. The next thing we wanted to share with you was kind of the opportunities that are currently being looked at, and some of you may well have picked up another acronym for the NHS, which is Integrated Health Organisations, and David's going to cover what that means and what the opportunities are for Northamptonshire. David, over to you.
Lovely, thanks, Faisal. So I've got 4 slides to talk through and just to share. So I'm going to talk through 2 things: Advanced Foundation Trust, or AFT, and Integrated Healthcare Organisation, or IHO. And the 2 are connected but slightly different. So the first bit will just do a quick run through of what Advanced Foundation Trust status is, and then I'll come on to the integrated care bit. And to be honest, for today's meeting, the Advanced Foundation Trust is a process inside the NHS that takes us to a place where we think we can have a very different conversation with the public and our communities about integrated healthcare and how we can change things. So I'll probably spend longer talking about integrated care than I will about the Advanced Foundation Trust status. Important bit being, you have to be an Advanced Foundation Trust before you can hold an integrated healthcare organisation contract. So Secretary of State announced in November a new NHS policy, which is called Advanced Foundation Trusts. And the ambition is that by 2035, all NHS large organisations called trusts would become Advanced Foundation Trusts. And you get permission to be an Advanced Foundation Trust when you've demonstrated that you are a really responsible organisation and a way of working things through. And when you get there, you get greater autonomy to innovate, really a greater opportunity to have less of a regulatory approach. It's grounded in, you're given the space to support and develop your local community and then address issues when they arise, and greater financial flexibility. We're in a really good position. If we go on to the next slide, Tracy, that when the Secretary of State announced the new policy decision in November, he announced that there would be 8 trusts in that very first wave. So on the left-hand side of the screen you're looking at the moment are the list of the 8 trusts, and we're number 4 on that list. So they've identified that they would like us as a group of 8 to go forward and develop to be an advanced foundation trust. So we're doing that at the moment, and we're going through a selection process, and we'll hear the outcome of that late April. Although what I expect to happen, and those of you who know that the workings in public service, is an announcement of who's been successful late April will come just before a number of different local elections around the country. So we will probably fall into a pre-election period where the government then doesn't announce things in order to provide independence while the election period is going on. So it'll probably be early May by the time that we actually get the update and we find things out. So that's us. It's a really good mix. It's an incredible privilege to be included in one of the 8 trusts across England being identified as being one of the ones who could take on additional responsibility in a way going. It's a real recognition of things that many people have done in this system and a way of going. And if I'm being really, really honest, I've got an amazing bit of proud that people are knowing where Northamptonshire is. It's really good that we can actually really champion Northamptonshire in the middle of the country and really get people to think about us, the needs of our population and the ways of going. So being shortlisted is an absolutely brilliant place to be. So the key, though, with all of this is we get awarded advanced foundation trust status, and then we get to move on to talking about integrated healthcare organisations. Now, integrated healthcare organisations have got a slightly government way of describing them because they are integrated healthcare, but they're not actually an organisation. They're a contract that we all come together on, and lots of different providers come together on to oversee a health budget for a defined population. My next slide, if we go on to it, Tracy, just gets us to sort of think about why that's important. So I think it's really important. If you think about a community in the bottom middle of that slide, you've got lots and lots of different people living there. You've got hospitals, you've got the police, you've potentially got prisons, you've got social care, you've got charities, you've got life going on in a community. Around the outside of every community, there are people doing commissioning. There are people sitting there and thinking about the services they want. So they might be from NHS England. They might be what we call specialist collaboratives. They could be in a host integrated care board. They might be in an integrated care board. They might be from the local authority. And Tracy, if you just click the mouse just anywhere on the screen, there we go, you'll start to see the range of different contracts that we receive inside a community for the provision of health and care. And so you can see the local authorities' responsibilities. Some of that then connects through with the integrated care board, the way that they're delivering work. Some of the work NHS England puts through specialised services to different commissioners. Some of it commissions directly to other people and other ways of working. So I think the world is quite complicated. People like me, my job is to understand and try and bring all of these different things together and the money and the way of working to connect the services together. And I think sometimes it's a problem or it can be a bit complicated. And I think there's a better way of doing it. What we want to avoid is lots of different silos of services. And what we really want to do is to try and connect up even more services. And if I gave you my little one to hold in your mind as a way that we've got to do this differently, if you look over on the top left-hand corner, there's NHS England, and the H&J is Health and Justice. Now, I have a team in NHS England who ask NHFT to provide some services in a prison. And we do that well. Glyn mentioned some of it earlier. There is then a separate team in a different part of NHS England who commission us to deliver different services in the same prison. And as a provider, we've got to connect all of this up and get people what they want. So the whole bit around an integrated health organisation is how do we all work together across the system, local authorities, commissioners, providers, voluntary community groups, social care, the police and everybody, and how do we get this into a way that makes sure that we reduce as many of those gaps in care and those ways of working and get the best use of money. So that's the thinking behind integrated healthcare. My last slide, if you wanted to go on to it, Tracy, was just to reinforce that. So while it's called an integrated healthcare organisation, it's a contract, and it's a contract that you can get if you're an Advanced Foundation Trust, and it gives you the responsibility to hold the budget and improve it for a health-defined population. It should, we talk in the NHS about shifting from hospital-based services to community-based services. We also talk about doing prevention rather than just treatment. And then we think about what does that mean about how you can do things differently and reinvest the savings into better population health and patient care. So that's something that we're focused on for the future. You can start to take the slides down if you want, Tracy, as I just summarised. But that's a future direction we're going. We're really excited about it. We think that what will happen, we'll find out late April, early May, whether we've been successful. It won't be implemented until the 1st of April 2027. So we would have basically 11 months to sit down with community groups, local authorities and everybody else and start mapping out what could we do, how could we do it. We don't think on day one it will be something that will just suddenly huge change, but actually we'd evolve and take it forward. And what we're hoping we can do is really cut down on those care gaps. And people have popped some stuff in chat about challenges and ways of working. So that's the sort of strategic view and how we think it will make a difference to our communities if we're successful and go forward.
Thank you, David. It's as you say, it's a real opportunity if we are successful.
Faisal on mine and just checking with Richard. I think Faisal's quiet, or is it my computer?
Could you hear me? Sorry, David, can you hear me?
I can actually, yes. I think it might be your end, David.
Can you hear me now, David?
It'll be my computer then. Let me sort it.
Okay. Right. Okay.
I've sorted it. Apologies,
okay.
That's operator error from me.
These technical glitches are sent to tries, David, always. But anyway, David, thank you very much for that presentation on integrated health organisation. And as you say, it's almost like a misnomer when they say organisation. It's actually about how the contract is awarded and held and to deliver services for a defined population group. It's a real opportunity if we succeed in securing the Advanced Foundation Trust and the contract for IHO, because it actually gives us real opportunity at a local level to work and expand upon all the good collaborative partnerships already underway. It's just a greater way of working together. Have we got any questions? I think there was something in the chat box. Again, I think that's a very specific question about so I've lost it again.
So Laura's just talking specifically about lymphedema services, particularly those non-cancer related, and the benefits and the ways of working. And the short answer for today, Laura, I'd say is absolutely what we need to do is to look at what are the services that make a difference, that keep people well, and how do we connect them all together, particularly around primary care, community services, ways of working. So it's those big changes that I think we can look at and feed in.
Yeah, thank you. And the other one, before I bring in Sue, was from Irene about additional resources for the integrated health organisation projects. And will that, because there's a concern that already stretched services might become more stretched.
I think one of the challenges for us is rather than technology will help us do existing services more efficiently. But what we're not trying to do is to ask everybody to do twice as much as they're doing at the moment. But what we do really think is if we sit down with voluntary community organisations, if we sit down with primary care ourselves, if we look at how do we develop a patient pathway better, it will give a different approach and a way of going, which will actually mean people get the right help first time or ways of working. So I don't think we're trying to squeeze more out of people, if that's a way of summarizing potential question. What we're trying to say is, how do we do stuff differently and bring people together in that? So
that's really helpful, David. And I guess given that this is a new initiative, government initiative, and as part of the Vanguard, I believe it's just ourselves and another organisation. I believe it's Northumbria. Is that right, David? We've been asked,
correct.
The first two that have been asked to go for this. So there'll be some learning along the way, along that journey, and the processes will become a bit clearer. But as you rightly say, this is about working differently to make sure that the pathways are developed and delivered in a different way and closer to the community. And at the heart of this is really to bring about greater integration. Let's see where we are. Sue, if I can bring you in with your question.
Well, it's just a comment, to be fair. Thank you, David, for that presentation. I am a lived experience advisor and a volunteer with Northampton Healthcare Foundation Trust. And also, I've been a resident of the Northamptonshire for over 60 years. And I just would like to say how exciting this is and how proud I am of Northampton Healthcare Foundation Trust for this opportunity, which is going to help improve patient experience and patient care. That's basically all I wanted to say. Thank you.
Thanks, Sue. That's very helpful and very kind of you to say. But that's also our hope. When we were talking about the opportunity that the Advanced Foundation Trust and the Integrated Health Organisation contract presents, all the board were talking not about what it means for us, but what it means for our communities. That was actually a really key thrust of the discussion, which made me immensely proud about having just joined the organisation as interim group chair in November. So no, you're absolutely right. So let's hope these come to fruition in the way we would like to see them. Joe.
Thank you. Thanks, Faisal. Just to follow up on David's point, sorry, I'm Joe Lancaster. I'm one of the non-execs, for those who don't know me. We talk a lot in the land of health about integration, but actually this is about simplification. My background is local government, and local government and health are often on parallel tracks. And we look at processes and systems. Actually, in its simplest sense, the opportunity that David's talked about is about reconnecting with people and just making it simpler. And that's the prize that's at stake here, which is removing duplication, removing overlap where systems just collide into each other, and just concentrating on making things better for people locally rather than being driven by external forces. Thank you.
Yeah, thanks, Joe. Very well put. I think the other reason that ourselves and Northumbria have been put forward for the IHO along with the Advanced Foundation Trust is because of already the excellent working partnerships and collaboration that's taking place, because that's one of the prerequisites, that you have to have well-established partnerships. You need to have demonstrated good collaborative ways of working, not just with other health organisations, but a wider range of partners. So that goes to the heart of, Joe, the point you were making. It's about simplifying things as well. Any other questions or comments on integrated health organisations and what it means and what we hope? No? Okay, well, David, thank you for that. I think that's been really illuminating. And as we get further information, details as emerge, and as we go through this process, no doubt we'll share this through our newsletters and various bulletins, and no doubt we'll bring this back at some point based on post-April, post-elections, when things are announced and we have decisions which we won't know until then, but we will make sure that we feed back into our members about this and what the next steps will look like. And then we're a little bit ahead of time, but that's not always a bad thing on a evening. We've got our governor's elections coming up, and I will hand over to Richard, who's going to just give us a bit of a preview about what that all means and for people who are interested.
Thanks very much, Faisal. Good evening, everybody. I'm Richard. I'm Director of Corporate Governance here, and thanks to Tracy, who's pulled this information together. As many of you, I'm sure, will know, governors represent our local community on the Council of Governors, and therefore have an influence over how the organisation is run. We've got 8 posts that are up for election in this round of elections, which is happening, as Faisal mentioned, now. So you can see listed on the slide towards the top the different seats that are up for election. So there are some public governor seats representing the Kettering and Corby area, Wellingborough and East Northants area, and the Northampton area. So these can be anybody living in those areas, so long as they're not a member of NHFT staff, as all staff would need to be within the staff constituency. In addition to those local governors that represent a particular area of the county, we've got 2 opportunities to become a patient and carer governor, and these are people that either are currently or have been previously a patient and or a carer of somebody using NHFT's services. There's more information, incidentally, on our website, which you can see linked there under the email address at the top. So that'll provide a lot more information on, well, what's the governor role, what's the commitment, what do I get in return, so that you can assess whether the opportunity might be right for you, or indeed to signpost it to somebody else that might be interested. As you can see in the table below, we've mapped out the key milestones, I guess, really, in the elections process to give you a sense of when the deadlines are for nominations and also when voting begins. Even if you're not interested yourself in standing, but you are signed up to be a member of the organisation, if you are a member in one of those constituencies, you'll be invited at the appropriate time to vote for the candidates that are standing in that particular area. So do look out for an electronic ballot paper that may be landing in your inbox or through your door later in the Q4. Yes, I think those are all the things that we need to point out there. So if you are interested in becoming a governor and you haven't got the answer to your question on the website, then do drop us a line via the Foundation Trust email address. Tracy, me, or one of our colleagues will be very happy to have a conversation with you about the opportunity. And indeed, if it's helpful, we could potentially connect you with a governor that's already serving on the Council of Governors if you wanted an informal conversation. But hopefully, Tracy, I've covered the key points there. Is there anything important that we need to add?
No, I think you covered all the points. And so, although there is no staff seats due up this time, we are encouraging members of staff to maybe think about friends, family, or even their own patients that they might be interested in these seats. So even though you can't stand yourself at this stage as a staff governor, just because all the posts are filled currently, we do have opportunities in public areas, and you may know somebody who would be interested in this, and just to let us know, really.
Super, thanks, Tracy. So just note in the chat that we missed an S off the address for the website, so we'll get that corrected before the slides go out. But if you are looking in the meantime, do use the address in the chat and not on screen. Otherwise, that might cause some confusion. Equally, if you are interested in finding out a little bit more and you are around on the 5th of February, but you're by all means welcome to observe the Council of Governors meeting, which is a meeting in public. It's happening in the afternoon at 3 o'clock via Microsoft Teams. So using the same email address, the Foundation Trust email address, you can request a link to observe that meeting. So do drop us a line if you are interested there. I'm just having a quick look in the chat. Yes, we will certainly come back to Irene with answers to her question regarding those specific questions, so you're clear who to expect a response from and in what time frame, Irene. So yes, we'll link with you outside if that's okay.
Thanks, Richard, and thank you for sharing the process for the governor elections that are coming up. And just to say that governors are a key and vital component of the governance arrangements for our organisation for NHFT, and bring a huge amount of skills, knowledge and experience and connectivity to our communities in Northamptonshire. So please, if you are interested or know people who might be interested, please help us to promote that. It will be great to get a good crop of people coming forward into the vacant governor positions, which will be great. Any questions or any queries, comments on the governance process? Mabel. Mabel, you're on mute at the moment, sorry.
Can you put it in chat, Mabel, if you can't unmute yourself?
Yeah, it's not coming through. I think Mabel's typing something, so let's see what comes through. Anything else from anybody else while we're waiting for Mabel to put something into the chat? No? Okay. Anything else on the elections or anything else for that matter, Tracy, that we haven't covered already?
No, I don't think so.
Okay, great. Still hanging on for, let's see. There used to be a function that we could unmute somebody remotely, but I think I certainly can't see that anymore in Teams.
Yeah, you can mute, but you can't unmute, I think.
No,
It's a one-way street, Faisal. Yes, we can turn the mic off, but not on.
Yeah, it was interesting because I remember they used to, or was that Zoom that you could do that? Might be confused. We've used different platforms in the past, so for various other things. So,
Maybe there's anything you want us to pick up, I suggest you just drop us a note because it looks like we've got some technical issues here with the muting and unmuting.
Yeah. Well, I think she's got some technical help arrived.
There you go.
Oh yes. Yeah. What? Yeah.
Okay. Can you hear me now?
We can hear you, Mabel. Yeah. Great to have you. Over to you.
Mabel Blades. I'm governor for East Northants and Wellingborough. I'm really keen on health promotion, and I feel there's a real gap in the area as regards men's health. So I've said this before, but I've been getting together with the Historic Transport Society and sort of in the final stages of organising with them to use their premises. Now, the Historic Transport Society is in Rushden. It's got trains, buses, all the sorts of things that appeal to gentlemen, and to use their facilities to do health promotion. This isn't just for me, it's for anybody who wants to really capture the attention of gentlemen. And they are willing to do any advertising promotion. So that's just me trying to push to do something a bit innovative, bit different. I used the facilities last year to promote care about diabetes, and there were a lot of interests and a lot of leaflets were taken. Apologies about my IT skills, but I hope you will like that idea on health promotion and promoting to our local population.
Oh, I think you're on mute now, Faisal.
Technology is having the better of us, I think, this evening, Mabel, between you and I. No, that was very helpful. Thank you for your contribution and sharing that information about the challenges with men's health, etc., but also through the transport. Did you say it was a transport museum? Did you say?
It's a historic transport society. It's more than a museum, really. They've got lots of buses, old vehicles. They've got trains. The trains do run occasionally, but not regularly, and they just run on a local track. They don't have the steam trains running, but you can imagine this is really popular for men and also their families to come to. They have events throughout the year, and they're willing to let us use some of the vehicles, and also they have a massive, they call it the goods shed. It's where the trains used to shunt into to unload their cargoes. So it is a massive facility. They say they won't charge us. They seem very enthusiastic. So I wanted to alert you to that. And that I am trying to do something as a governor.
Well, thank you very much, Mabel. I mean, Richard's put in the chat box as well. You're saying that it's a great initiative, and if you make sure that it's shared with our membership and engagement and representation committee to make sure that we get as wide a kind of exposure to this as possible, that'd be great.
Thank you.
And I think Tracy's saying we've talked about engaging with men at the membership group, and staff governors have offered to help provide some support. So yeah, I think this is it's one of those things that we've got to keep treating like the onion, keep peeling layer by layer, because there's a number of initiatives, and we still find that men's health, and including men's mental health, I can't remember, was it this morning on Radio 2? I think it was Vinnie Jones was speaking about men's mental health, and on the Scott Mills show, I don't know how it tuned into that, but I was happening to be listening to that this morning briefly, and that was about, again, the challenges that and the reticence of men to come forward to talk about men's health, and even more so when it comes to mental health, and him talking about those things, and the King's Charles talking about his experience with cancer, how important that is to bring that forward. So yes, thank you for that, Mabel. Very much appreciated. Anything else from anybody? Any comments or questions on the things we've had a presentation on? As always, these sessions are very informative. We get very good engagement from our members and our colleagues joining in. No? Okay. Well, I don't want to prolong the evening for anybody. I don't think there's anything else on our agenda for today that's anybody's made me aware of. So in that case, thank you very much for joining us for this members webinar, which hopefully you found stimulating. And if you and by all means, that you've in the chat box, you've got the foundation email address. If you think of something afterwards that you thought I forgot to ask that, please do email us. We're only too happy to try to respond to and make sure you get the answers that you're looking for. So please do reach out. But otherwise, thank you for attending this evening. Tracy's just reminded me in the chat box, the slides will be sent out separately, so you can read those at your leisure after this session. So they'll be out either tomorrow or Friday. So you've got those. So lovely to see you all here, and till we're back for our next members session. Wish you all the best for this evening and for the remainder of the week. Take care for now. Bye-bye, everyone.
Bye-bye.
Thanks, everybody.